topic is also a bit big compared to what I would speak. But anyway, I said that the policy to ensure the safety and health of vulnerable populations, in this case, the aged people during extreme weather in Japan. So first, I'd like to just show the situation in Japan. So as you know, in Japan, we are faced with aged society compared to other countries, economically developed countries. Its speed is really rapid compared to others. And this is the population decline and aged society. As you can see, the population of Japan is decreasing. At the same time, we have more aged people. So this is this is the situation, and it bring about serious issues for especially to cope with the extreme weather in Japan. And yeah, something wrong with this. But I'd like to also point out something about household composition. So here you can see that this is the total household numbers. And in 2020, almost 40% of household is one-person households. And the question is, who are they? Of course, young people. It includes young people who are just get independent from their parents, started to working and so on. But here, I'd like to highlight another aspect of this one-person household. It means that this is the data of the type of household here in Japan. So in 2020, we have about 55,000,000 households. And among them, we have about 22 million households or elderly households. And among them, about 6 million or 6.7 million households are one-person households in elderly households, meaning that elderly people living alone. So about 6.7 million elderly people are living alone. And its ratio is dramatically increasing from 2005. You can see that about in 2005, its number was about 3.8 million, but in 2020, its number jumped up to 6.7 million. So we have not only more aged people, but also we have more aged people living alone in Japan. And this is also important information about disaster, coping with disaster, especially extreme event like heavy rain and typhoons. So this showed recent heavy rain and typhoons victims and its ratio of the aged people. Let's start from the bottom here. The heavy rain event of 2018, about 70% of the victims was 60 years old or older. And in case of typhoon Hagibis in 2019, about 65% was aged people. And the heavy rain event of July 2020, about 79% of 65 years old and older was about 79% was 65 years old or older. Its ratio is higher compared to the population ratio, so that they are the vulnerable people. But we have more and more vulnerable people in Japan. And I'd like to show you three data, but I'd like to summarize its important implication here. First, many of the disaster-related deaths are among the elderly. So if we have some extreme weathers, and like typhoon and flood, of course, some people unfortunately are killed by this event, but even they survive this event, but they suffered from environmental change. In this case, environment is in general, not natural environment, in more social environment and any kind of environment. Because of this change, some people get sick or have some issues and finally die. So this is disaster-related death. So many of the disaster-related deaths are among the elderly. Most of the disaster-related deaths occur within 1 month, and the cause is more related to the evacuation life rather than issues with healthcare or facilities. So here, this is the data, disaster-related deaths. You can see that this is the total number of disaster-related deaths, And I think more than 90% of the disaster-related deaths were found in elderly people, in this case, 60 years old or more, especially from 70 years old, 80 years old, and 90 years old. There are so many people die because of, yeah, of course, because of type 1 flood disasters, but not direct death, not because of this kind of natural hazard, but after this event, they are suffered from something. And here, this is also another data, but among this disaster-related death, when they died, so that almost 50%, almost half of the disaster-related death happened within 1 week after the extreme weather event. And if I include within 1 month, its ratio is almost 3/4. So that after the this kind of extreme weather event, we have to also care about victims' situation, especially evacuation situation. And there's the reason why they died. I mean, they died because of disaster-related death. The majority is that because of physical and mental strain due to evacuation life. And the third is physical and mental strain caused by the shock of the disaster. And in the fourth, we have decrease or cessation of function in care facilities and also medical institutions. But from here, we can see that basically, of course, the healthcare facilities are really important. But majority of the disaster-related deaths were caused because of the evacuation life change or their change in the environment, so that we need to care about it. So this is my final section. I'd like to briefly explain the Japanese system, how we cope with it. Well, I want to say that this is in progress. So I'm not sure if it is a good practice or it can be learned from other countries, but I'd like to explain how we are thinking in Japan. This slide just simply shows the community, how can I say, community-based disaster management organizations. So elementary in many areas, it depends. In some areas different, but in general, we cope, especially community level, we cope with this kind of events based on elementary school district. So in here, for example, we have elementary school. This is designated as an evacuation shelter. And in this area, we have community-based groups like neighborhood association, community-based disaster management group, community-based fire corps, and PTA, and so on. So that they are the main actors for disaster risk reduction in terms of community-based. But this is not enough, especially for the vulnerable, especially the aged people. So how Japanese government is tackling this one that I'd like to explain briefly about it. Figure is a bit complicated, but this depicts the community-based integrated care system. If I explain all, I think it's not enough. So let me just briefly explain it. So despite the growing elderly population, the number of hospitals, care facilities, and caregivers is expected to be insufficient. So to address this issue, the Japanese government aims to establish a community-based integrated care systems by 2025. This system would provide comprehensive support, integrating medical care, this side here, and nursing care, daily life assistance, and also welfare services. So, as I wrote here, the community-based integrated care system is envisioned to be implemented within the daily living areas, especially the middle school district. I say that in case of disaster risk reduction, basically we are based on elementary school district, which is smaller than the middle school district. It's a bit bigger, but this district is a kind of reference point because, we think that necessary services are generally provided within 30 minutes. And here I'd like you to pay attention to care managers. A care manager is a professional who provides consultation to individuals requiring nursing care or support, assesses their physical and mental condition, and creates care plans to ensure they receive appropriate services, especially the aged people. And additionally, they coordinate with municipalities, service providers, and so on. So that this is a welfare community-based integrated care systems for the aged people. And these two systems should be combined. And this is it's what we are doing in Japan. So I'd like to show here there are different types of support in society. Here we have public support, is a kind of governmental support, and mutual support. It's a cost sharing among insured individuals, like health insurance and so on. And self-support, it means do it by yourself. And reciprocal support, it's voluntary mutual aid within the community, not backed by a formal cost sharing system. So this the last one. Reciprocal support corresponds to this kind of support in a community for disaster risk management. So just I'd like to point out several how can I project how we protect the elderly people here. Wait a moment, please. Sorry. Okay. So registry of persons requiring assistance in evacuation. So if they cannot evacuate by themselves or they have some difficulties, we have a system that we make a kind of evacuation support framework for those unable to evacuate independently. So we start from one. Municipalities has data, this kind of data, who are the H people and so on. So they confirm whether registry information can be provided to supporters during normal times. And if they agree, they will provide this kind of information to their supporters, like welfare committees, self-defense organizations, this is a kind of community organization, and fire department, and so on. And in normal times, daily check-ins, monitoring, and conducting evacuation drills are conducted for them. And during the disaster, support related to evacuation actions can be done. So that here we have these kind of supporting systems. But in some cases, some H people do not want to share their private information because this is very personal, things. But if we include, in some cases, if we include care managers who has close relationship with aged people, if they join or if they are involved in this process, they are fine to share the information because they have close relationship with them and trust them, so that it's easier for us to conduct this kind of support. And the time is limited, so let me just we have this kind of individual evacuation plan, and also this is the individual evacuation plan. So here you can also see that this is a kind of list or kind of document that they can share. They make it before extreme weathers. And here they write not only their names, private information, but also they write who evacuate together. To write it, they have to decide before. So who can support will be found in this, especially here. This can neighborhood associations or some other community organizations. So we combine between disaster risk reduction and welfare policies here. Of course, we knew that it is important. But in this Japanese situation, we found that this kind of specific project or specific system is really important. How we connect between disaster risk reduction and also welfare policies. And even after extreme weathers, we have welfare shelters to not only to protect their safety, but also health for disaster-related death, against disaster-related death. Usually we are going to evacuation shelter. Then if we found that they need some support, they can go to welfare shelter. But if they have this kind of individual evacuation plan and also kind of this kind of coordination with other actors, we can decide that, okay, this person needs assistance. So they don't have to go to evacuation shelter. They can go to welfare shelter directly from their houses, of course, with some support. And they have to have this kind of, not contract, but kind of, not promise, but kind of this kind of, let's say promise in advance. That's why they can do it. So that this is also related with disaster risk reduction and also welfare policies or projects here. So finally, I would like to emphasize that that this is a figure depicting the welfare in the community based, but this is really important for disaster risk reduction as well. As I said, if we get involvement from care managers, it's easier to conduct. And of course, if they have this kind of system, it means that they have social network. This is really important for disaster risk reduction. And also in some cases, the support to live healthy for as long as possible. So in this case, they have, it is related with tsunami evacuation in some cases, because when they want to evacuate, they have to walk. But if for some cases they cannot walk, they need some support, or maybe in the daily life, they should have some kind of walking in daily life so that they can walk in a tsunami situation as well, so that their health, physical health, is really closely related with evacuation and also other disaster risk reduction policies as well. So finally, I'd like to emphasize key point here that in an aging society, especially in Japan, supporting vulnerable people in the pursuit of equitable cities is crucial, and it could be a turning point for community cooperation and cross-sector collaboration. This is depicted here. Okay, thank you very much for your listening.